Hi there, my name is Dr. Jeff Anderson. I'm a doctor of chiropractic and acupuncture in the Southwest Denver area. For over 22 years, my primary aim is to help people minimize their pain and maximize their function to get them back to their lifestyle as quickly as possible. At some point in your life, most of you are going to get lower back pain if you haven't already. Most people that go see a medical provider for lower back pain, their primary focus is to eliminate that pain as quickly as possible. Most of us have been trained through television commercials or magazine print ads that a very easy way to take care of that pain and inflammation is to take an ibuprofen or an NSAID drug. However, there's 3 research articles I'd like to share with you today that shows you this might not necessarily be a good idea. A March 2015 study showed researchers investigating 20 years of NSAID use in non-union fractures. A non-union fracture is simply a fracture that will not heal. What they found during this 20-year retrospective study was during the years that doctors increased recommendations for NSAID use for those fractures, those non-union fractures would not heal. During the years that doctors decreased the recommendations for NSAID use, they found that the non-union fractures actually dropped. Now, most people don't have an injury in their broken bone. Most people, when they do get an injury, it is from the muscle, the tendon, the ligament, or the cartilage. However, what the study showed was these tissues too were also affected. What ibuprofen and NSAID drugs do is interfere with proteoglycan and prostaglandin synthesis. These are 2 essential compounds in your body that are absolutely essential for your tissue healing. Without them, tissue healing just will not occur. A January of 2015 study recently showed researchers criticizing the use of NSAIDs or ibuprofen for elderly patients with non-cancerous pain. In the study, they found out that 75% of this adult population was deemed inappropriate for NSAID and ibuprofen use for their pain. Not only that, they found out that the NSAIDs and ibuprofen actually increased the acceleration of osteoarthritis and deterioration in their joints. Furthermore, the study recommended that athletes do not take ibuprofen or any NSAID drugs at all, because not only does it interfere with their healing, it actually prevents them from getting onto the field as quickly as they could. In 1995, the North Carolina School of Medicine performed a study looking to see if ibuprofen and NSAID drugs actually helped with tissue repair. They broke this study group into 4 groups. They had a control group that received no ibuprofen or any exercise. The second group received exercise only. The third group received exercise with ibuprofen, and the fourth group received ibuprofen only. They looked at the tissue samples 72 hours post-injury, and what they found is in the exercise-only group was the only one that showed any improvements in fibroblast production from the prostaglandin proteoglycan synthesis. What they also found was in the ibuprofen-only group that prostaglandin and proteoglycan synthesis was completely lacking. There are other alternatives to use besides ibuprofen and NSAID drugs when it comes to managing your inflammation and controlling your pain. Tune in next week where we go over these alternatives.